So one last question here, and I'll let you take the first answer here. It's from Don. How can I demonstrate the benefits of implementing KaiNexus and process improvement strategies to improve patient flow through the ED, a topic near and dear to your heart as an ER doc, and the rest of the hospital so that hospital administrators will hear and understand? So I think it's a classic question of somebody trying to sell up in the organization, right?
I think that if you're in a hospital setting, then there is no hospital I'm aware of that's not trying to increase flow in the emergency department. So to me, I think it's very simply make sure that everyone knows what the current status of your flow is, and then as those numbers, as your door to doctor, your door to dispo, or your doc to dispo, your dispo to actually leaving the ER, as all of those things improve, people are going to wonder, how did you make that happen? And at that point, you're going to say, well, actually took some hard work, but let me show you how we engaged our 100 ER staff, actually implemented over 350 improvements that all directly related to flow over the last year, and none of them will blow you away, but here are some of the rock stars that we didn't realize was going to have a huge impact, but it did. So you got to give some examples. People like stories, and then little by little, all those really add up. And so, to me, I think the proof is in the pudding at that point, and I wouldn't focus on the methodology as much as I would focus on the outcome, because I think if people see the outcome, then they say, well, I want some of that. And then you can backtrack. Okay, well, let me show you how to get to that point.
Yeah.
Mark?
Yeah, because a lot of times people will say, I don't have the budget yet to do this organization wide. So that's where a small test of change, a pilot, can be effective. And what I would hope in any successful pilot of continuous improvement strategies with KaiNexus software on top of it, is going to lead to really noticeable results where someone's going to look and say, well, we want to scale that across the organization. I've seen times where people start with lean or continuous improvement in the middle of the organization, or kind of a guerrilla activity within the organization, and that sparks interest because of those results. Sometimes it doesn't. I mean, I think there's a risk of that. But sometimes leaders at the least will say, hey, I like the results, I want to see more. And better yet, it might pique their interest to learn more about lean and continuous improvement or whatever strategies.
And I think that from the kind of KaiNexus part of that, for one, almost all of our customers will start at some smaller level, whether that's 100 people, 20 people, 300 people. It's usually some percentage of the entire organization, and the system is really set up to show impact very well. So I think if you are in an organization where you have a local leader that is completely bought in, and your intent is to blow that out of the park, hit that out of the park, and then spread from there, you really want to make sure that you're measuring impact. If you already have the senior leadership bought in, and they don't necessarily need all the little decimal places in the exact right order, then I would probably de-emphasize measuring all the exact impact exactly, and just go forward and conquer. But to me, this is almost how every organization starts, Mark. I mean, organizations that have never heard of these principles. I guess there's probably some people that hear of the principles and immediately take to it. But I would say that those are the minority of people. I would say the majority of people come to it by saying, how is that organization so good at what they do, and then backing into it.
Yeah. Okay, well, we'll leave it at that. We're at the bottom of the hour, and as always, 30 minutes of Ask Us Anything with great questions from our KaiNexus community. That goes quickly, but I'll encourage people, if this is the first one you've listened to, go and subscribe to our YouTube channel and check out the Ask Us Anythings. You can listen to them through the KaiNexus podcast, which you can find at kinexus.com/podcasts, iTunes, all the usual places. Check out our blog.kinexus.com. And also make a quick plug for the next webinar, the presentation style webinar that's coming up next on August 30th. It's titled Teaming with Patients to Improve Safety. And it's something I hope that people will be interested in, whether you work in healthcare or if you are a potential patient, which is, I think, everybody. So we're going to be joined by Laura Townsend, who is the co-founder and president of a nonprofit I'm on the board of. They're called the Louise H. Batts Patient Safety Foundation. And she's going to be joined by a retired physician leader and a nurse leader, talking about how we can all partner and work together to help protect patients. So that's going to be on August 30th. Go to kinexus.com/webinars. Greg, do you have a final thought for the audience?
My final thought is there's no better day than today to spread continuous improvement. So get out of your offices, go to Gemba, and start spreading the word.
All right. Thanks, Greg.
Thank you.